Hello everyone, and welcome to this to this audio podcast. In this audio podcast, and as part of this, as part of our RPSG and KDOS collaborative, and as part of the Illmatix series. This is an audio podcast surrounding education dysplasia. And I thought I'd provide a sort of a basis in around in this audio podcast in and around a basis in around chronic kidney disease. And once again, this is a RPSG and KNARS collaborative aligned to a Storm Robotics production. This is the Shientist. So in this audio podcast, there's sort of several questions, and I'm gonna seek to highlight perspectives around the different questions. So number one, what is chronic kidney disease? And in answering this particular question, in primary or preliminarily, um, uh, uh, um, a previous audio podcast in this series, in this particular series, along with other particular audio podcast series, highlight some bases around the severity and classifications in and around chronic kidney disease. However, CKD, or as it is abbreviated, chronic kidney disease, is a complication that is a health complication, or complication that stems primarily from primary health, or can stem from primary health comorbidities, and at least in the adult population, according to population health, in context of population health, ultimately where CKD can ultimately becomes multi-systemic. In children or in pediatrics and young people, CKD etiology can originate for several reasons, from congenital, hereditary to endocrine and physiological complications. And owing to the nature of the disease, CKD patients also can encounter various healthcare services, such as laboratory investigations, alongside many others. Many other sort of particular aspects of healthcare services. CKD patients are or can be prescribed several sort of forms of medicines throughout the disease pathway. And also in regards to the disease pathway, there's sort of a disease pathway that is in regards to different forms of renal replacement therapy, or RRT, and thus in context of renal replacement therapy, aligned to pre and post transplant as well. CKD patients are being CKD patients in some works and literature are encouraged to or have been encouraged to take ownership of aspects in relating to the sort of disease disease pathway. And patients want more face-to-face understanding of investigations at the same time, or at least have health professionals be part of sort of discussions, or online discussions, through for example, through sort of blogs and social media, and etc., wherein patients can get more sort of wherein patients can get more sort of a sort of overview in particular aspects of healthcare and in and around and specific to scenarios. And so, by improving patients' understanding as well and education relating to those sort of important laboratory tested investigations, this can also reduce inequality and improve healthcare in and around the CKD, in and around the chronic kidney disease or CKD population. So, question two. Is what are the main issues surrounding sort of the educational support for CKD patients right now? So one of the main answers around this is support for patients with long-term conditions like CKD can be ascertained through a variety of mechanisms between health sectors and from health professionals, and this can be sort of multifaceted. The understanding provided by an array of health professionals relating to different aspects of the disease or the condition can add complexity. And patients can see several members of the multidisciplinary team at varying times, and this can cause complexities around different investigations alongside different aspects of CKD more longitudinally. So another question is what mechanisms of educational support exist? Where patients would normally see more than one health professional, identifying and having access to peers to help inform shared decision making is advantageous, but further advantage would be where professionals and patients can schedule online consultations with those who are trained to provide sort of education and health service, where it's becoming more important owing to more aspects of service that have been denoted as being remote. And at the same time, online support groups or online spaces and sort of organizational sort of websites, for example. For example, in this context, the Kidney Disease and Renal Support Group, or KDARS for Kids, which has been working through social media to improve CKD, chronic kidney disease awareness since 2014, and the Renal Patient Support Group, the RPSG, since 2009. Empowered sort of patients are more probable to make informed decisions surrounding healthcare choices, and so education is also an important mechanism as part of that sort of pathway. And between the RPSG, the Renal Patient Support Group, and KDARS, there are currently over 12,000 service users between the two social media platforms, respectively. And question 4 is education support around the science of chronic kidney disease important? So to answer this question, I would like to provide context whilst it is to be to be appreciated that healthcare professionals that are referred to as healthcare scientists do not really train to have sort of a clinical involvement per se in aspects of patient care. However, they do have an unused knowledge base, and one of the main things in aspects of healthcare more generally is to involve health professionals such as healthcare scientists, and to provide bases around sort of aspects of diagnoses and diagnostics, with aligned to sort of the rest of sort of clinical medicine, and to also make crucial layman bases available around particular aspects of CKD, aligned to sort of aligned to saving also saving saving sort of also aligned to saving lives, but also wherein sort of the unused knowledge base is in and around at least in around aspects of educational support is applicable, is important, where all allied health professionals, for example, are are have sort of have a response have a sort of a responsibility to provide CKD patients or patients with particular health conditions, long particular conditions, and healthcare, particular aspects of healthcare and conditions, where there's a responsibility for health professionals that are sort of, again, traditionally not patient facing, but also those who are patient facing, where collaboratively with patients are very important in providing in providing aspects of educational support, and especially where, for example, again, CKD or chronic kidney disease is mainly a disease or condition that has a basis around pathology and laboratory medicine, and so again, the sort of educational aspect in and around this the science of CKD is important in that context. And so this then leads into question 5. The implications, or at least the basis around point 5, I should say, where in and around the implications to practice and research. So educating health professionals about the importance of both sort of the importance of sort of evidence-based practices alongside aspects of sort of health, alongside healthcare, are important more generally, and evidence indicates, or at least some evidence indicates, that healthcare professionals using professional or expert language or technical jargon without patient having sort of knowledge in the first instance will continue to act as a barrier to communicate. And so targeting the attitudes and behaviors of service providers through potential solutions is important, so that the sort of associations and relationship between service users and service providers is um, is uh, is um, is collaborative, is more collaborative than anything else. So the summary around this is around this particular audio podcast on education dysplasia. Collaborative patient-centered practice is designed to promote the active participation of each discipline throughout patient care, and collaborative working enhances mechanisms for continuous communication, optimizes staff participation in decision making within and across disciplines, and fosters respect for multidisciplinary contributions from all. And in line with this, I'm gonna there's a few sort of resources that are part of this particular audio podcast, and in the descriptive information on social media, this context will some of these resources will be listed out. And listeners checking in on this audio podcast are more than welcome to access these at their own at their own times. That draws this audio podcast to an end. This has been an RPSG, an audio podcast where there's a RPSG and KDAS collaborative, aligned with Storm Robotics production. This has been an audio podcast as part of the Illmatix series, and it's been an audio podcast again on education dysplasia. And thank you for tuning in.